considered to be a silent killer in Nigeria today? Dr. Bisi Olarinwaju is in the house to tell us how to deal with this monster. Stay with us. My name is Edak Willie. Welcome back. Doctor, welcome to our program.
Thank you.
Please introduce yourself.
My name is Dr. Bisi Olarinwaju. I'm a primary care physician with Regina Mundi Catholic Hospital in Lagos.
Okay, it's good to meet you.
Thank you.
Today we want to talk about BP, which is considered to be a silent killer. What is BP? High blood pressure, I guess. What's that?
Okay. It's important to note that when the heart pumps blood throughout the whole body, through the arteries, the BP is a measure of the force against the walls of the arteries. Now, high blood pressure, otherwise referred to as hypertension, is a persistently elevated BP. The BP is measured as a fraction, so you have a numerator and a denominator. The numerator is called the systolic blood pressure, while the denominator is called the diastolic blood pressure. The systolic blood pressure is a measure of the pressure when the heart beats.
Okay.
The diastolic blood pressure is a measure of the pressure when the heart is at rest, that is during the filling phase.
Okay.
So when you talk about high blood pressure, otherwise referred to as hypertension, you're talking about an elevated, persistently elevated blood pressure.
Okay. So what are the causes?
Now, it's known that there is no known cause of hypertension, but there are risk factors. I must also state that you have two types of hypertension. The essential hypertension, which starts at about the age of 40, and then the secondary hypertension, which, as the name implies, has a primary underlying pathology.
Okay. I don't really understand what you're saying. Please break it down.
Sorry about that. Well, we talk about primary hypertension, essential hypertension, as it were. It starts at about the age of 40. There are associated risk factors without no particularly known cause.
Okay.
I'll go ahead and tell you about the risk factors associated with this hypertension. We associate factors like race.
Okay.
Hypertension is more common in Africans.
Okay.
The risk is higher. And then smoking also is associated with increased risk of developing hypertension, as well as obesity, excessive alcohol consumption, sedentary lifestyle, stress, certain drugs, and all of that are associated with increased risk of developing hypertension.
Can it be hereditary?
Yes, there is a genetic predisposition to developing hypertension.
Young people in their 20s and 30s also suffer from hypertension. Why is it so?
Like I earlier said, hypertension in the young may be of a secondary cause. So there may be a primary pathology in the body, a primary disease condition of another organ manifesting as hypertension in the young. And that is why when you find hypertension, it is important to see a physician that would run the basic investigations to determine the primary cause of the hypertension.
What are the primary causes?
I have told you that it could be secondary to drugs. It could be...
Could it be food?
Excessive alcohol consumption, excessive salt intake. In this environment, we don't have regulations about stuff like that, but I'm aware that the American Heart Association recommends that the average daily intake of salt should be less than 1,005 milligrams daily.
Okay.
Don't ask me how to measure that in our basic Nigerian diet.
Yeah. But could it be like using teaspoon to how? Maybe just give us an idea of what is it 1,000 milligrams?
I think generally speaking, you should reduce the salt in your diet. And then it's important to note that with this onslaught of junk food everywhere, almost at every bus stop, you have the eateries with a lot of junk food
Chemicals
that is very, very rich in salt.
Okay.
All this, the cumulative effect of this is increasingly predisposing people to developing hypertension.
Okay, how about pregnant women? They also suffer from hypertension. What is the cause and how can it be managed?
Hypertension in pregnancy is a dire emergency, and it requires special attention because of the associated risk to the mother and to the unborn child. And as such, those women with hypertension in pregnancy should actually be managed in the hospital settings.
Okay.
And that's part of the reason we run antenatal clinics, to pick up these women who we consider as having high-risk pregnancies and to take appropriate care of them in pregnancy, during labor, and delivery.
Okay. In our society, we in Nigeria, or let's say in Lagos, we are so full of stress. Can this be a factor too?
Well, stress can cause a temporary spike in BP readings. And that is because during stress, we have a trigger of hormones, stress hormones, that may lead to increase in blood pressure. This may be transient. However, it is also noteworthy that persistent cumulative effects of stress over a long period can also increase the risk of developing hypertension.
So what are the effects of this high blood pressure?
High blood pressure, otherwise known as hypertension, is a systemic illness, and as such would affect various organs of the body. It is known that persistent high blood pressure increases the risk of cardiovascular events or accidents, as it were, stroke, sudden death, and that's why it's regarded as the silent killer.
Okay, so you talk about stroke. There are some that will say that it's as if somebody slapped them hit them on the head. Is that hypertension? And that is like sudden death. It's as if somebody slapped me and he slumped, and that was it. Okay,
let me lay foundation by saying that most of the time when an individual has hypertension, there are no symptoms at all.
Okay.
And I'm sure that's what informed the topic of this discussion, as it being a silent killer. A lot of people expect that when they have hypertension, they will experience certain things in their body as symptoms, but most of the time, there are no symptoms. By the time you are having symptoms in the body, it's usually at the end of the spectrum, when something is about to happen, like you've just described, for a patient who is about to have a stroke. So for people who go about their daily activities, they may not experience anything.
So at the end of it, what are the kind of symptoms that they...
A patient may experience dizziness, may experience headache, persistent headache. There may be visual disturbances. There may be feeling of lightheadedness, and some other things.
And at that point, it's almost late.
Yes, you shouldn't wait until you experience any of these things before having your regular BP checks. It is recommended that everyone should have regular BP checks.
But when, because I have to go back to that slapping on the head. Is it a part of it? Is it stroke? Is it hypertension? Because like in the villages, they'll say a spirit slapped him or ghost slapped him. Just, I heard, wow. I hear all those stories. So is it linked to it?
That is a dangerous sign leading to a stroke, most of the time.
But most of the time, the patient does not survive that.
Most of the time, they do not survive it.
Okay, so...
Some of that time, they do.
They do? Okay. Still to come, how can we manage this illness? Let's take a break. We'll be right back.
There's plaque in everybody's mouth. It forms every day. That is why we need to clean daily.
Back pain, can be said to be a result of wear and tear.
Yeah, that's
Raise one leg up and then try and pull it to your chest. Your head down. Just relax.
Some of these infections, like particularly like tetanus right now, it's something where if the mother is immunized, the child is actually protected for the first 3 months.
Medicine from your kitchen. Today I want to share one tip with you, how you can use your coconut as medicine. Hi, my name is Edak Willie. If you want to know how to stay healthy and fabulous, join me every week. Welcome back. Dr. Bisi, please stretch the question. How can we manage this illness?
The best form of treatment has always been and will still remain prevention. So the essence of a healthy lifestyle, healthy diet cannot be overemphasized. Now, aside that, when the patient is now diagnosed as having hypertension, it could be managed by simple lifestyle modification, which would involve weight reduction, cut down on alcohol consumption, cut down on smoking, and then regular exercise lifestyle. You could also be managed with drugs, and then you could have a combination of the two.
Talking about cutting down on weight, does it mean that slim people do not suffer hypertension?
No.
They don't?
It doesn't mean that slim people do not suffer hypertension.
Okay.
But remember that we said that a risk factor for developing hypertension is obesity. Okay. So for people who are obese, you will have a need to cut down on the weight, which helps to reduce the blood pressure significantly.
Just a risk factor. So are there some drugs that can be recommended or foods that one can eat to prevent hypertension?
Except the lifestyle modification will include a reduction in alcohol, smoking, high cholesterol diet should be cut down, weight reduction, and then regular exercises.
Mm-hmm. I've also heard some cases that someone was exercising. Some people during exercise they just dropped dead, and they said that they didn't need to exercise.
I don't think there's a situation where anyone does not need to exercise in that way. But it is better to have a well-organized, regular exercise life, which preferably should be supervised. For people who have never had an exercise life, you are not expected to just jump on an exercise program. You should have a regulated exercise program.
Let's take a break. When we come back, we are going to have some guests ask the doctor some questions. Stay with us. We'll be right back.
Asthma is a chronic disease of the lungs, of the airway.
Smoking also is associated with increased risk of developing hypertension.
There is plaque in everybody's mouth. It forms every day. That is why we need to clean daily.
Back pain can be said to be a result of wear and tear.
Yeah, that's
Raise one leg up and then try and pull it to your chest. Your head down.
Welcome back. Let's welcome Mercy to come and ask her question. Come, sit.
Thank you very much.
You're welcome. Please ask Doctor your question.
Yeah, Dr. Yoba, thank you for having me on your program.
You're welcome.
Actually, this question has been on my mind. It's about my mother. She died of cardiac arrest. The day it happened, she was cooking in the kitchen, and then suddenly she slumped. And then when she slumped, there was nobody at home to help her up. By the time we came back, we met her on the floor. We took her to the hospital, and the doctor said it was rather late, and it resulted into stroke. So in future, or in view of that going forward, how do we address that kind of situation?
Okay. First of all, sorry about your mom. Now, the essence of the message you are trying to pass across as hypertension being a silent killer is that for most of the people who have this condition, it may go unnoticed for years. You could as well be walking around, going about your normal daily activities without any suspicion of having a high blood pressure or hypertension, as it were. And that is why we're making the point that for people who are hypertensive, please visit your physician, get your medications, and use them regularly. For people who have a risk, ensure that you're checking your blood pressure regularly. Now, there is this erroneous conception in our environment where people think that once they have been able to achieve, after being diagnosed with hypertension, once they have been able to achieve a normal tension, a normal BP reading, they imagine that the BP has gone away and will stay away, which is not true. You need to keep using this drug. You need to keep checking the regular BP. Reason being that at the time when you have accidents like occurred in a mom, there may be no telltale signs. And some of the time it may be redeemable, and some of the time it's too late.
Okay. So it is advisable that you check your BP every now and then. You don't have to wait or...
Yeah, it's advisable that you check your BP regularly. And it's even easier now that we have the electronic monitoring device that are easier to use and can be used at home. Almost like we use our GSM phones. I mean, there are so many sophisticated phones around that people get around to use. You have the electronic monitoring device, which are very easy to use, and everyone can check their BP regularly at home as a size when they have their regular health checks in the hospital.
So you have to check it regularly. That's every day.
Not every day.
Okay.
Not necessarily
okay.
every day.
How often should one check?
That would depend on the risk, on the individual risk of the person involved,
okay,
and as advised by the physician. But on general terms, it's advised to have your BP readings at least twice a year in the hospital.
Okay, twice a year.
You can check more frequently with your monitoring devices at home.
Mm-hmm. Okay. Thank you, doctor. Mercy, thank you very much.
Thank you.
Back pain can be said to be a result of wear and tear.
Yeah, that's the
Raise one leg up and then try and pull it to your chest. Your head down. Just relax.
Some of these infections, like particularly like tetanus right now, it's something where if the mother is immunized, the child is actually protected for the first 3 months.
Medicine from your kitchen. Today I want to share one tip with you, how you can use your coconut as medicine. Hi, my name is Edak Willie. If you want to know how to stay healthy and fabulous, join me every week. Tony, welcome to the program.
Thank you for inviting me.
Please ask Doctor your question.
Doctor, there's this rumor that is going on and it's really happening in Nigeria. Some young men just got themselves and buy laptops. And
is it a rumor or
it's happening?
It's happening,
yes.
Okay.
Even one of my colleagues has it. He has gone for the training and he told me that he'll be collecting 50,000 naira to scan. I said, because my mother is under that sickness though. So I was trying to ask him that how can I go about with this thing that is in my hand? And he said that he has gone for the training already, that I should pay 50,000 naira for the scan, then he will place my mother on drugs. I said, but you're a cameraman, for God's sake, how come you started all that? So please, can you just educate us on that?
What did he start?
He went for the training.
Training of what?
Of hypertension.
Okay.
Yes.
So what is he using to?
A laptop.
A laptop.
Yes.
Okay.
He said the laptop can scan.
Okay.
The patient, and the laptop will detect what is wrong with the patient.
Okay.
And I was wondering, how come from one place to you being a doctor?
Please, doctor.
All right. I think it is important to sound a note of warning that, like, with a lot of things that are not being regulated in our country, in our particular situation in Nigeria, there are some of these people that go around with machines that supposedly check almost everything there is to check in your body. There is no scientific basis for such machines that will check your BP, check your blood sugar, check your cholesterol, your liver function test, your electrolytes, and do almost a complete body scan on you at one sitting without even taking any samples from you. There is absolutely no scientific justification for that. And I'd like to close it on a note of what a senior colleague said. What you do not understand the basis for, a disease condition that you do not understand the basis for, there is no way you can lay claims. You cannot diagnose it. There's no way you can lay claims to treating it.
Okay. So maybe in future it will have adverse effect, or one cannot really tell.
Of course, that is what is happening in our environment. You have people laying spurious claims that cannot be verified.
So.
And then they give unsuspecting Nigerians a lot of concussions to take, and nobody knows exactly what is contained in those concussions, and there is nobody doing any study to tell the effect of these things in the long run.
Okay. Thank you, doctor. Thank you very much for coming. Thank you, Tony.
Thank you.
We'll be right back. Medicine from your kitchen. Today I want to share one tip with you, how you can use your coconut as medicine. If you are tired or you have some overdose of medication, you are just feeling somehow, coconut water will give you that instant energy that you need. It balances out the electrolytes in your body. What you do is that you get a coconut. Fresh one is always better, but in case you don't have fresh one, coconut, the dry one will still do a good job for you. You need half a glass or a full glass is enough. Just drink it. You'll see you'll be so revitalized. This is natural, doesn't have any side effects. It does wonderful things to your body. So next time when you are feeling weak or you overdosed on anything, this is always the instant solution, instant remedy. Any overdose of anything, this will neutralize it. It's used as a neutralizer for such things, and at the same time, you have this instant boost of energy. Thank you for watching and enjoy your coconut water. My name is Edak Willie. See you next week.